Hello everybody and welcome to the Wednesday edition of Video Clips. Still doing this 4 days a week. A couple things I'll mention. We have two great mental health options via teleconference that are helping a lot of people who can't afford therapy or have difficulty moving around because of where they live. One is for depression and anxiety, and the other is for people who are dealing with specific issues related to COVID, disagreements with family members, isolation, financial struggles, loss of friends and loss of job, all kinds of things. So if you're interested in those, let me know. Career training from home, that's the good part about training with us. You can live anywhere, be anywhere. And this is a good time. People are a lot more distrustful of the government and medical systems than they were just 3 months ago, and so it's a good time to be learning how to help people in a different way. And you don't need any prior training. We have programs for people who have had training. We also have programs for people who have had no healthcare training. And then upcoming courses, contraceptive options for women going on right now, and you can always listen to the recordings, join in. ALS, fibromyalgia, and Cancer 201 are coming up. I teach them live through teleconference, and then we record them so people can listen to the recording, and then I put them on a video platform once I've taught it live. So the benefit of the teleconference, it's sort of like a dress rehearsal for me, and people get to ask questions. When you're watching the videos, obviously it's not live and interactive, so if you want to be in the live and interactive group, PamPopper@MSN.com. All right, I want to talk about children today, and because I think this is an important issue that we should spend time on. Our rulers have imposed increasingly draconian restrictions on us, much of which doesn't make any sense at all, which I talked about yesterday. The destruction of lives and liberty and jobs and livelihoods and the separation of families and the destruction of our society. Well, the emperors and empresses who are at one time elected officials are not concerned about such things. They consider these consequences to be necessary in their battle with this virus that kills less people than seasonal flu. And they shame anybody who even dares to talk about such things. And sometimes I think maybe it's even intentional. Let's just destroy society and break up families. I mean, I'm increasingly having difficulty believing that this is a random thing going on all over the world. But in any case, it's pretty easy to just accuse people of not caring and all that sort of thing when you're sitting in your lovely home as an elected official, now called ruler, with your comfortable salary. And a lot of these people were rich before they ran for office, so these people who want to reopen their flower shops and give haircuts, you can understand looking down on them from that standpoint, right? So, and of course, making sure that any dissenting view is immediately quieted. After all, you know, the reason you become the ruler is because you're powerful and because you know so much more than everybody else, right? And why would you ever want to consider what's going on in the lives of the people who are now your slaves and servants? Well, one of the things our rulers and their accomplices, otherwise known as health officials, are telling us is that they're following CDC guidelines. And the term guidelines, by the way, just so you know, doesn't mean regulation or law, but our rulers and their accomplices treat them this way and tell us we must comply with them. And some of these guidelines concern our children and schools. According to the American Institute for Economic Research, closing schools in March was essentially a grand, unethical, social experiment designed by supposed infectious disease experts. The AIER says, quote, "We consider the experiment to be unethical because there has been no informed consent either from parents or children or even our legislative representatives. The bottom line is that our children's future and the quality of their lives has been sacrificed to conduct this experiment." School closures, stay-at-home orders, and shutdowns have been very difficult for all children, but especially hard for two types of kids. One is those from lower socioeconomic backgrounds who often live in cramped conditions in blighted neighborhoods, and they're victims of the digital divide. I mean, all this homeschooling, schooling at home, not homeschooling, but schooling at home, was really completely inaccessible to a large swath of the children who were subjected to it, and then autistic children and other kids who have special needs. For many poor kids, schools and libraries and parks are a welcome refuge from the turmoil, chaos, and sometimes even abuse that they may experience at home. So when all these closures happened, it took all these resources away, along with access to social services and counseling and extracurricular activities. The business failures, which resulted from the lockdowns and the draconian rules for amusement parks and tourist activities and that sort of thing, have made it almost impossible for the teenagers to get jobs. That will hurt these kids a lot. And of course, with lots of time on their hands, they're more vulnerable to influence and recruitment by gangs and organized crime, and that's going on right here in Columbus where I live. Talk to people who actually live in some of these neighborhoods, not the emperor of our state and his accomplices, the health department officials, but actually go talk to real people who live there, and they'll tell you this is going on. Autistic and other special needs children have been especially hurt. For example, social interaction is a real important part of treatment for autistic children. They haven't been getting much, if any, of this. Routines are often very important to these kids. They don't deal well with uncertainty and restrictions on their activities. And these kids require highly trained and and certified special education teachers and one-on-one attention. You can't deliver this by Zoom. I mean, even older people in nursing homes who aren't autistic or special needs just tune out after a while. It's one of the common things I hear from people is that, visits started at about 30 minutes, and by the time 3 months had passed, grandma was spending about 2 minutes on Zoom and hung up. It's just not the same as personal interaction. What makes all of this especially egregious is that there was never any need to lock down any of our kids for any period of time. It's well known that children are at extremely low risk of contracting COVID, and I'm going to give you some data in just a minute from another source, so hold that thought for a couple minutes. The CDC, the agency that develops the quote-unquote guidelines, reports that school-age children are more likely to be struck by lightning than to perish from the virus. And as for transmission to teachers and parents, very little transmission, and the average age of teachers in the United States is 41. They're not part of the vulnerable group. Because our rulers chose to take nonsensical CDC guidelines and treat them like mandates and laws, the CDC has essentially become a new branch of government and has taken over education in the United States. Without any scientific justification at all, the CDC has told our rulers to keep adults 6 feet apart and that social distancing should also be the new norm at schools. Other CDC recommendations for reopened schools include preventing students from sitting together on school buses, closure of cafeterias and playgrounds, mask wearing in school dividers, and petitions. Some schools are also planning on preventing students from talking to each other at lunch. That's great moments in public health, because we all know preventing interaction between children is always a good thing to do. It results in really healthy, emotionally healthy children as time goes on. And lunch, if there is even going to be lunch. Some of these schools are talking about having kids come in a couple days a week and 2 hours and then a different shift and no cafeteria. And I mean, this really, I agree with the AIER. This constitutes state-sponsored child abuse. I agree with that. I think that's what you call it. The state-sponsored child abuse actually began in March, and we already know that kids have been adversely affected. I have reported in previous videos about the increased incidence of child abuse, child suicide, and the fact that a significant percentage of children are sliding backwards academically at a very frightening rate. It seems that our rulers with their bosses at CDC want to continue all of this that I just mentioned indefinitely as schools reopen in the fall. The new normal means that kids will be denied the chance to develop socially and emotionally as a result of normal human contact through sports and informal play and socialization and activities and all the things that normally happen at school. It's one thing to torture adults. I don't understand it, but I just don't understand anybody who could do this to children who are the most vulnerable, okay? And also the people who, some of these clowns who do this stuff are supposedly, when it's not talking about COVID, seem to be the most concerned about children, economically disadvantaged people. Well, put your money where your mouth is. Why don't you get consistent with what you're doing and what you say? Talk is real cheap, okay? Now, as a counter to this, all right, according to a report from the Hospital for Sick Children, kids should go back to school in September, and school should be a normal experience, not the dystopian experience that schools and school systems have planned. Quote, "We have to accept that COVID-19 will stay with us for a long time. We must move on with certain activities in our lives, such as schooling, while keeping in mind that there are a lot of ways to mitigate risks," says Dr. Ronald Cohn, President and CEO of Sick Kids and one of the authors of the report. According to the scientists who authored the report, children account for a very small percentage of COVID-19 cases, both globally and in Canada. And even in children who have symptoms, the incidence is low. Dr. Jeremy Friedman reports that 5,000 children with symptoms had been tested at the hospital, and they found 30 actual cases. The hospital tested 1,500 asymptomatic children and found no cases. The report says that stay-at-home measures have been particularly hard on children and have a negative effect on behavior and mental health, lead to more depression, exposure to domestic violence, child abuse and neglect, and even child suicide. So this is up in Canada. They're seeing exactly the same thing that I just reported here in the States. So here is what these doctors say should be done. They said, first of all, it is better for parents to determine if their kids should stay home from school. Isn't that what we've always done? Than have all this temperature checking and nonsense going into school. It's going to make school start late. It's just absolutely not necessary. Kids should be taught how to clean their hands in a non-judgmental and positive way. I mean, making kids afraid to be alive and be around people. What kind of person would think that that's a good idea? Please tell me what kind of person other than a despot would think that this is a good idea. It's not reasonable for children to wear masks at school. Yeah, think? Physical distancing is not recommended as it, quote, is not practical and could cause significant psychological harm. Outdoor activities like recess should be permitted and no social distancing is needed. Sports and physical education should be encouraged and schools should offer as many of their usual clubs and activities as possible. Virtual learning could be encouraged for children who are immunocompromised, which we've always done that, kids undergoing cancer treatment and things of that nature. Sick Kids reports that it's been in communication with Ontario's Ministry of Education to provide guidance. It's good advice for schools everywhere, however. And I just want to mention that if you live in Ontario and you're still being subjected to nonsense, it's not because doctors, real doctors who are concerned about kids and see kids who are sick and being abused and have drug problems, and real doctors are telling the schools or the government what should be done. So I think that going back to what the AIER says, we should stop letting our children be victims of this cruel experiment and get back to normal. And in the absence of that, pull them out. I've mentioned before, we are going to have a homeschool resource center. And understand there's a difference between schooling at home, which is they're still enrolled in the system and all this nonsense going on, versus pulling them out, withdrawing them, and homeschooling. Many people think that it's much harder to do this than it actually is. So next week I'll be able to give you some resources, an actual place to go that we have created, will have created by then, with instructions and Q&A and answers to your most important questions. Okay. All right, that's it for today. As usual, pass this on to people who you think would benefit from watching it. And then remember, tomorrow is the 4th of July. It's announcement day. All right, thank you for watching.